Hi, Dr. Pelto. I want to talk today about how a patient was able to avoid having surgery who was a runner on his plantar fascia. I have multiple patients that come in for second opinions after they see other doctors, and a lot of people, they have limited tools in their toolbox. So for example, this patient, they had 3 cortisone injections, they had a pair of orthotics, they had physical therapy, they had stretching exercises, and the doctor said that the next thing was to cut through the plantar fascia, and they came in for a second opinion. So with these patients that they're seen by a lot of other doctors, and I have my patients, they go to other doctors as well, it's a challenge. So they've had good care. You assume that the cortisone was done in the right spot. The first thing I did for this patient is I got an ultrasound, and I saw that there was a lot of thickness in the bottom of the plantar fascia, and they had never had some of the regenerative treatments. We do very good in our office with second opinions for patients that have heel pain, and they need a regenerative treatment. The most common one is called Shockwave. So for this patient, we did 6 sessions of Shockwave. We do them a week apart, and then by about the 5th session, 5th to 6th sessions, where patients start to feel better because the tissue regenerates and his pain went down, and the swelling in the inside the fascia went down, and he was able to run. He was able to keep running with his orthotics and everything else. I didn't have to change the orthotics. I didn't have to change his loosening exercises. He just needed more of an advanced modality that's called Shockwave. So if you're struggling with plantar fasciitis that's not getting better, you want to see a patient that does regenerative treatments. You want to see someone that does Shockwave in their office. There are a couple of different types. There's radial and then there's non-radial, and we have both of those in the office for patients that need it.